Well, welcome back. Here is another video for focus board review on antibiotics. And this time we're going to be specifically looking at the protein synthesis inhibitors. So let's jump right into it. The protein synthesis inhibitors can really be broken into two larger groups. One that targets the 50S ribosomal subunit and one that targets the other. And we'll get there in just a second. But first we're going to be starting on the 50S ribosomal subunit. And the drugs that we'll be focused on fall within the classes of oxalodenones, streptogramins, and macrolides and ketolides. And I've listed all of the drugs over here on the left. Again, just to kind of for you to see them in their entirety. But here they are, and we'll walk through these classes. And what I've done is I've condensed all the information you need to know about these drug classes onto a single slide. So let's go ahead and start with the oxalodenones. The oxalodenones really are made up of two different drugs. There's linezolid and tedizolid. Now these bind the P site, or the protein site, of the 50S ribosomal subunit, and by doing so they prevent the initiation of protein synthesis. So this here is our mechanism of action. A mechanism of resistance is a point mutation on that binding site where the oxalodenone would bind. And a key adverse effect to be aware of with the oxalodenones is myelosuppression, and it can occur if the patient is taking these compounds for greater than 7 days. The clinical use of the oxalodenones is that it's mainly used for gram-positives. It's enterococcus, streptococcus, staphylococcus, and gram-positive rods, as well as MRSA and vancomycin-resistant enterococcus. One other thing to mention here about the myelosuppression adverse effect for oxalodenones is that this can go away when the oxalodenone is discontinued, and that this adverse effect is mainly in relationship to linezolid. The next group of protein synthesis inhibitors we'll talk about are the streptogramins. The streptogramins really only consist of two drugs, dalfopristin and quinipristin. However, more often you might see these referred to as streptogramin A and streptogramin B. That's why I've included the A and the B here. Now, you won't ever see dalfopristin and quinipristin by themselves. Streptogramins are always given together, and this range is seen here where it's 70% to 30% is the ratio of dalfopristin or streptogramin A with quinipristin or streptogramin B. Now, just like the oxalodenones, the streptogramins bind the 50S ribosomal subunit. And both of these agents have a slightly different mechanism of action. It's really quinipristin that inhibits the polypeptide elongation, so it's the protein synthesis inhibitor. However, it's dalfopristin that enhances quinipristin binding. So here, this is quinipristin's mechanism, and then here is dalfopristin's mechanism. So dalfopristin is really synergistically interacting and allowing quinipristin to actually work better. Resistance mechanisms for the streptogramins involve enzymatic inactivation, and the adverse effect to be aware of is that an infusion site reaction can occur, and this often manifests as pain with the streptogramins. Clinically, streptogramins are used in gram-positive, and it's important to note that these drugs are inactive in gram-negative bacteria. So some examples of where you may use streptogramins clinically include MRSA, M. pneumoniae, C. pneumoniae, and Legionella species. The last group we'll talk about here are the macrolides and the ketolides. Really, there's only one ketolide listed on this list, and that's telithromycin. The macrolides listed are erythromycin, clarithromycin, azithromycin, and fidaxomycin. Again, just like all the drugs in this grouping, these all bind the 50S ribosomal subunit. However, they do have a slightly different mechanism. The macrolides and ketolides halt protein synthesis by preventing protein translocation from the A to the P site. There are some mechanisms of resistance with the macrolides and the ketolides, and these include efflux and binding site mutations. The adverse effect to most be aware of here is GI distress, and this most often occurs with erythromycin. Clinically, these drugs have a fairly broad spectrum, targeting both gram-positives and gram-negatives. So here's some examples. So like sexual transmitted infections, chlamydia species, azithromycin is a really good option. The macrolides and ketolides also target Neisseria species, Rickettsia species, T. pallidum, and B. pertussis, as well as some atypical pneumonias that are listed out here. So let's now jump to the next large grouping of protein synthesis inhibitors, and these are the ones that target the 30S ribosomal subunit. And these include the drug classes of tetracyclines, glycocyclines, and aminoglycosides. And again, just like in the prior division slide, I've listed out all the drugs for you over here at left. So let's get started with a discussion on tetracyclines and glycocyclines. So here's the tetracyclines and glycocyclines. Now the glycocycline in this list is tigecycline. The rest of these drugs are tetracyclines, and they include doxycycline, tetracycline itself, and minocycline. Now, unlike some of the drugs we just talked about, these are binding a different ribosomal subunit, the 30S. And by binding this 30S ribosomal subunit, it actually prevents tRNA from entering the A site, which blocks polypeptide elongation. So this is how it's enacting its protein synthesis effect. How is this drug resisted? Or how are tetracyclines and glycocyclines resisted? The answer is through efflux, reduced binding, and enzymatic inactivation. Adverse effects to be aware of include GI irritation and effects on the bone and the teeth. The effect on the bone and the teeth is an adverse effect that I do want to talk about because tetracyclines can bind and actually bind quite well to the calcium of newly developing teeth and bones, so calcium. The use of tetracyclines in children can lead to permanent brown discoloration of their teeth, and the use of tetracyclines can actually cause fetal defects in bones and teeth, so it's avoided in pregnancy. Now, this side effect is less of a concern with tigecycline, but it's something that I bring up because it's something that's unique that you might see on your board exam. Clinical uses of tetracyclines are listed out here, including MRSA, Rickettsia species, chlamydia species, T. pallidum, M. pneumoniae, and even in the treatment of acne. Tigecycline has a little bit different clinical use. It's a little bit more broad spectrum anaerobic and can target MRSA, VRE, and Enterobacteriaceae and B. fragilis. Tigecycline is actually able to overcome the efflux and reduced binding mechanisms of resistance due to its glycyl amido moiety. So this difference in the structure of tigecycline is what allows it to start to target more of these perhaps resistant bacteria that a normal tetracycline wouldn't be able to cover. The last group of protein synthesis inhibitors are the aminoglycosides. The aminoglycosides contain streptomycin, gentamicin, tobramycin, amikacin, neomycin, and paromomycin. Just like the tetracyclines that we just talked about, the aminoglycosides also bind the 30S ribosomal subunit. However, they result in an irreversible inhibition of protein synthesis. And this happens through three distinct mechanisms of action. The first is a fixation of the 50S and 30S ribosomal subunits to the AUG start codon on the mRNA. The next mechanism is an inhibition of the formation. So I'm just going to inhibition of form of the 70S bacterial ribosome. And then the third one is an induction of errors due to its binding of the 30S. So errors in the protein itself. So through these three mechanisms, aminoglycosides are able to halt protein synthesis. Resistance can develop due to enzymatic inactivation, and the main adverse effects to be aware of include nephrotoxicity and ototoxicity. Now, these are very unique in the bacterial world, these specific adverse effects, so it's something that you might see with aminoglycosides. Clinically, aminoglycosides are used to treat aerobic gram-negatives, and these include Enterobacter species, E. coli, K. pneumoniae, and P. aeruginosa. The other thing that I want to point out here is that aminoglycosides are often combined with beta-lactams, and this actually expands the coverage of the aminoglycoside plus the beta-lactam to include some gram-positives. So this wraps up our time together. Hope you learned something very quickly in this quick and dirty review of protein synthesis inhibitors. These are the sources where I drew my information from. And thank you very much for listening.